to try and have minimal contact with it. So if I can just push it through around, especially down in there, I will. So I'm just going to come through and kind of push this around. And like I said, with regular patients, it's a whole lot easier. So I'm going to push that up in there. Get rid of this. Do I need to be sterile anymore? No. I don't need to be sterile anymore. So this dressing's already on the patient, right? Is it sterile now?
No.
So I'm just going to make sure that it's flat and there's no ridges or anything, because that can cause skin breakdown, right? So next thing I'm going to do is change this posy out. And this is important that you pay attention to this. You cannot take the old posy off until this posy is in place completely. If you take that one off before you put this on, you risk this coming out. Okay? So this is what makes it kind of hard. So you kind of have to push the old one down. And these are Velcro straps. This is Velcro. And you want to make sure the letters are on the outside, not the inside. Okay? So when you're putting it on, they should be this way. Letters on the outside, so you can read the size. So I'm going to come over here, and I'm going to stick this in. And some of you are going to struggle with this, especially if you have bigger fingers. And I just go ahead and put that one on. Sorry, sir, about the ambu bag on your head. Right, so I put that on. And this guy's probably not supposed to wear small, but that's what I had, so I'm going to loosen it up. And then hopefully your patient will be setting up. And then you're going to come around here. Yeah, this is too small for him. But it's the only one that was in there. We'll have to look for some more. So you would come over here and fasten this as well. Okay, so it's fastened on both sides, yes? I already fastened it. So the next thing I'm going to do is come around here. This one's way too big for him. It's Velcroed in the back. So I'm going to come around here, and I'm going to unvelcro this one. And take this off. Well, we get one that's too small and one that's too big. Pretend this one is still Velcroed on there. Pretend. Because it's too small. And we're going to take this one off and get rid of it. Now, just so you know, we're going to have you actually change these out. For cost efficiency, facilities don't typically change these out every time you do dressing or do a trach care, because it's not resourceful. So some patients you'll get, and these will be saturated with like frothy sputum or boogers, because a lot of times it runs back onto the neck. So if it's visibly soiled or saturated, that's common sense that you would change it, correct? And see, this is a posy, and this one's huge on it. This one doesn't even fit. So you would only change that if it was saturated. We have you guys change it just so we see that you remember to make sure the new one's on before the old one comes off. So if you take the old one off before you put the new one on, you'll have to recheck, because this trach just fell out. And now you don't have an airway, and you have an obturator hopefully on the wall. You have to insert that and call for them to come up stat to reinsert. And that doctor's not going to be very happy with you. Okay? So this is in place. I get everything put there. This one fits here. It won't Velcro. If I Velcro this, he's going to turn blue. So we'll just pretend it's on there. And then what you need to do is make sure you can't get any more than one finger breadth in there. So it shouldn't be super loose, but it shouldn't be where your patient's turning blue either. Okay? So that's in place. And then what you're going to do is you're going to document that you did trach care, aseptic technique. You're going to document anything down here. The trach area, if there's any redness or swelling or bleeding or drainage or anything, you would document that. And I'm talking about a redness around it or anything. And you can also document that you removed the inner cannula and cleaned it under aseptic technique, inserted that, blah, blah, blah. Patient tolerated well, everything. And one thing I do, you guys don't have these, but when I do trach care, trach suctioning, I put the pulse ox on the patient's finger the whole time. So I'm watching the pulse ox the entire time. It's not part of your checkoff, and it's not included, but it's a smart thing to do, because if their sats start dropping, you can see right there, so you know what to do. So I just always put the pulse ox on the whole time I'm performing, because you're taking their airway, right? And we know that you have suction there already set up from when we did the suctioning, and it's functional, and we have oxygen there available, yes? Okay. Any questions? No? Yes? It's not that hard, it's just getting your thing.